Good morning, everyone. Good to be here. So, just a brief introduction. I am a postdoctoral research fellow in the School of Public Health in UCC, and one of my research interests is the area of alcohol research. It was part of my original PhD evaluation of a third level alcohol prevention program. And now, currently, I'm funded through the HRB under the Applying Research into Policy Research Fellowship, looking at alcohol related policy. So, as I said, the focus of the current research is on alcohol policy, specifically on the Public Health Alcohol Act, which is, I'm sure all of you are well familiar with this act. It is very much a landmark piece of legislation in this country, and there is quite a lot of international interest in it as well. As the literature has referred to it as a world-leading package of alcohol policy reforms. So I suppose another area of interest is implementation science, looking at the implementation of either programs or evidence or services. But one of the calls to action, or if you like, gap in the area of implementation science that has been highlighted is the lack of research on policy implementation. So often there's this assumption that once something is enacted, that's it, the job is done. The policy has been enacted and the work is done. But what we increasingly know is that actually a lot of the hard work starts then once the policy has been enacted. So I suppose taking those 2 points, the focus of my research, as I said, HRB funded research, first of all, is to look at the barriers and facilitators to the implementation of the Public Health Alcohol Act. Secondly, to look at public understanding and awareness and how we can better communicate policies of this nature. And then thirdly, looking at media framing of this legislation. So we're just in the current write-up stage at the moment of the results of the first part of this research, and I just would ask people not to share any of these on social media, as it hasn't been published yet. But I just thought it'd be a nice opportunity to talk to you here today, first of all, just to say that this research is underway, and secondly, maybe to give you some of the flavour of the initial findings. So in our first part of this research, we've conducted interviews earlier this year with a range of stakeholders, policy stakeholders, implementers, people implementing it on the ground, and also public health experts. So I suppose leveraging and harnessing the benefits of implementation science, we're using a very well recognised framework called the Consolidated Framework for Implementation Research, which really acknowledges a multi-level range of factors that can influence something like implementation, including policy. So not only the inner sector where the policies or the programs are implemented, but also things like the outer setting, the policy itself, individuals involved in the implementation, and also the implementation processes. So just to give you again a sense of maybe some of the findings around that. So first of all, what we found so far in the study in terms of the policy itself. So there was, I suppose, some of the positive comments was that the Public Health Alcohol Act aligned with Best Buy policies, international policies. This was deemed a strength and it increased confidence in the policy. It was also acknowledged the importance of a multi-component policy because the drivers of alcohol consumption, there are multiple drivers. So if you needed a multi-component policy, that one policy alone was not enough. However, I suppose what's interesting is that, that while it is very, welcome, very much welcomed, the difficulties of implementation on the ground, that's what we're trying to bring out more. So things that have been challenging, including things like the costs and complexity of implementing a multi-component policy. The costs, particularly structural separation, was highlighted by some of the private sector implementers like retailers who highlighted the cost of implementing something like this, particularly for smaller retailers. Also, people perceive gaps in the policy, so particularly in relation to the online marketing and sale of alcohol, and also the no-low products. And I suppose it highlights that it takes a long time to formulate and to enact policies, and that in the meantime, the ground or the landscape can change. And this is one of the issues that has arisen. Secondly, in terms of that outer context, so one thing that is interesting is the perception that industry lobbying and advocacy continues into the implementation phase, that it doesn't just end, in other words, once the policy is enacted. And in a sense, as the literature highlights, it highlights, if you like, the politics of implementation, that the policy cycle isn't just a discrete set of stages, that some of this agenda setting can continue into, if you like, the implementation phase, and that, if you like, implementation, as the literature said, can be quite messy. In terms of the inner setting then, I suppose like a lot of implementation research studies, resources was an issue. So, for example, issues raised include the lack of personnel and training for environmental health officers, who are the people who are enforcing this on the ground. Also the need for extra resources for those private sector implementers due to the increasing raft of legislative changes, that this required resources for such organisations. And also capacity in for example, in the Department of Health as well. These resource issues were highlighted. In terms of individuals then, the role of individuals was highlighted. In terms of facilitators mentioned included the expertise and knowledge of key civil servants in the Department of Health. Also the technical knowledge of people like the environmental health officers, who had that policy learning from, for example, implementing tobacco policy. However, again, there was questions raised of, who's in charge of this policy, who owns the policy, who's overseeing its implementation. I suppose, again, that brings us to the point about, implementation planning, which was highlighted. There was a lack of implementation planning, a lack of action to evaluate this, even though there were some measures put in place. It was felt that this had stalled somewhat. And I suppose, again, we're great at designing policies in this country, but often we forget about that important implementation phase. Just in the interest of time, I suppose just some closing remarks. I suppose, first of all, implementation science can be leveraged to help us to analyse policies, and by providing us with the frameworks and the knowledge. Secondly, that the policy cycle isn't a straightforward set of discrete stages, that some of those agenda setting activities continue into implementation, and also the need for adequate resource and planning, that the work of policy doesn't end once it's enacted, that actually sometimes a lot of the hard work can begin then. Just a final note there, just to acknowledge my advisory group. Some of you are here today: Professor Neil Fitzgerald, Dr. Zubair Kabir, Sheila Gilhaney, and as I said, we look forward to sharing the results of this in the coming year. Thank you.